Hi, everyone. I'm Hartford Healthcare's Tina Verona. Well, the Travelers Championship is officially underway at the TPC River Highlands in Cromwell. Hartford Healthcare is proud to be the volunteer sponsor for this year and for the past 10 years. Volunteers are out on the course right now in a safe and healthy way to help the players. And to keep the rest of the golfers safe throughout the summer season, I'm so happy to be joined by Dr. Cliff Rios, an orthopedic surgeon at the Hartford Healthcare Bone and Joint Institute. Nice to see you, Dr. Rios.
Nice to see you again, Tina.
Well, the Travelers Championship looks a little different this year without spectators, but rest assured the golf season is in full swing. Let's tee it up first with some tips on how golfers can avoid injury.
Well, I think similar to every sport we see, adequate preparation is really the key. A lot of us come off of the winter months, perhaps not training or stretching or doing some of the things that matter. And I think with any sport, you have to understand the pattern of injury that people may see. In particular, when it comes to golf, we see a lot of low back related problems just because people don't tend to focus on their back and their abdominal muscles. And any other, if they've had some aches and pains leading up to it, it's probably good to be evaluated and understand the extent of the injury or extent of the problem before going out and playing.
Well, yeah, I mean, it's during different times, many or all of us are just coming off of self-isolation and being at home and perhaps probably not being outside or doing a lot of exercise. So what's the first thing as golfers, begin to head out to hit the golf course? What should they do first in terms of trying to get themselves back into the swing of things, so to speak?
Well, I think the key, the answer to that question is a bit variable, and I think it depends really on what is someone's baseline level of function and shape. If this is someone that has been doing this every year, but took a few months of relative inactivity, I think the simplest aspect is starting out with some basic cardiovascular exercise and seeing what the tolerance is to that. And also just getting assessment of what your mobility is. Some people, particularly if they're not stretching or doing exercise, muscles tighten up, joints tighten up, and that can predispose people to injury. So I think the best advice I can give is that if anything is aching or hurting, it's probably worth getting evaluated, even if it's starting with your primary care provider, and if necessary, seeing one of the orthopedic specialists, just to determine if that's just a regular muscle ache or pain, or if there's something like arthritis or a more serious condition underlying that might require something like physical therapy or other assessments.
What areas of focus on the body should golfers be concentrating on when they're warming up?
I think it's a lot of joint mobility. I already alluded to the low back as being a common source of problems. The low and mid back really for golfers. It's sort of an understated area of interest. People tend to focus on their knees and their shoulders and the other joints a bit more. But I think just going through a spine stretching program is helpful. Those are some of the more common injuries we'll see. But also if people are having some shoulder pains, perhaps a lot of us were doing some home improvements during the quarantine, and maybe we're not all fit to be carpenters per se. But if they notice while doing some of these more physical tasks that some of those joints are bothering them, obviously they deserve a little more attention.
As golfers begin to hit the courses, what's the most common injury that you often see?
The most common problems that we'll hear about are spine related. Some of those may just be minor sprains between the bones of the back. There could be some muscle strains. And in more significant cases, some people may actually get some pinched nerves, which can cause symptoms to radiate down one or both legs. And so those are the most common. If some people, for example, have some underlying hip or knee arthritis, they usually know this leading into it, but if they may find that walking the course is a bit more of a challenge, and they may feel the need to take a cart. So sometimes if people are going out and walking, for example, 300 to 500 yards per hole, their arthritis, which was relatively quiet during our convalescent period recently, might become more symptomatic with the increased activity.
And some golfers may just want to push through that with the increased activity if they're feeling some aches or pains, or they're just probably so happy to be out on the course and and playing again, and may not come and see you. But when should they come and see you?
I think, I tell my patients, if they're recovering from an injury, the first step, if they're getting back to an activity and they feel an ache and pain, the first step is certainly not to panic. You can try the basic, RICE with the, rest, ice, anti-inflammatory medication. And as long as the symptoms quiet down pretty quickly and people can return to what they think is their baseline level of function within, perhaps a reasonable amount of time, a few hours or a few days perhaps, they can probably just continue to work through whatever problem they have. But certainly if they're performing and they feel that their performance is inhibited because of pain or limited mobility, or if they start to notice joints swelling or losing mobility, those are things that we should probably evaluate to determine the underlying cause.
Right, and not to delay, because in effect you could possibly make a potential injury much worse.
Yeah, there are certainly some injuries that could be made worse. Golf generally is a lower risk sport for that because golfers typically are not at any risk of any major collisions the way some of our other athletes might be, and I wouldn't certain injuries I wouldn't want a very forceful collision. But usually within golf, it's a predictable. You know where you're walking, you know where you're swinging, and you know how you feel with each swing, and people can gauge based on if they swing and they feel sharp pain and feel like they can't swing again. Generally, they'll rest from that and give us a call. But golf overall, I'd say, is lower risk for an acute exacerbation or an acute worsening of underlying orthopedic problems.
I think it's also important to stress safety at the Bone and Joint Institute for people, if they do need to come in and see you, that precautions are in place, safety protocols and measures have been put into place. Let's talk about some of the action that's been taken to ensure a safe environment for patients.
Yeah, so that's been really the focus of our discussions lately. As you know, I'm the director of the sports medicine division for the Bone and Joint Institute, and it's really a collaborative effort just with obviously some orthopedic sports medicine surgeons, but also sports neurology, sports cardiology, and clearly the rehab folks within Bone and Joint Institute Rehab Center. And a lot of our discussion, we've had tremendous concerns, certainly among golfers and really every athlete, particularly our adolescents who haven't been quite as active with organized sports, that as things open up this fall, may be at high risk for injury. And so some of the measures that we're taking, certainly there's the standard antiviral measures with spacing out appointments and appropriate hand washing and distancing. But within our sports medicine division specifically, we're looking at pre-participation physicals, perhaps taking those a bit more seriously than we have in the past, really trying to tease out any athletes that are having some aches and pains, because one of the biggest risks of getting injured is perhaps being deconditioned leading into the sport. And so I'm very quick to refer people for physical therapy assessments. Clearly, we can do some evaluations in our orthopedic exam rooms, but using things like the motion lab and really just seeing how people move and understanding how certain movement patterns can predispose people to injuries, both acute and overuse, is really helpful. And so there are, as it pertains obviously to our golfing tournament, there are very specific rehab exercises for the golfer. They focus on a lot of hip mechanics, low back mechanics, mobility drills, things that will help you from getting those overuse injuries when you're playing.
Yeah, and I think that's important to mention is the rehabilitation part of it. Even if someone does have surgery, they tend to either skip the rehabilitation part of it, and that's such a key component in recovery and such a vital step, but it is a commitment. And you have your physical therapists at the Bone and Joint Institute every step of the way to help golfers or athletes in general recover from any type of surgery. But I want to talk about the importance of the rehabilitation part of it that sometimes people often skip.
Yeah, Tina, I always say in orthopedics, that's the best and worst part about my job is, we can all, there's lots of talented surgeons out there, but it really is teamwork. And if the patient isn't committed to their rehab and they don't have the best rehab specialist, the outcome is just not going to be as good. It's not, I joke with our general surgery colleagues, you can take out an appendix and it's pretty hard to mess that up once you're all done with the surgery, but well-done surgical procedure just isn't going to get the same functional outcome and the same level of satisfaction that the well-rehabbed person will. And it's always the most satisfying part when we see someone who's very committed to their rehab and they have a good working relationship with their therapist, because they're just very enthusiastic. They tend to do much better, and in the end, they're the most grateful in terms of being able to get back to what they want to do.
Absolutely, such a vital component in the recovery process. I want to talk about, you mentioned briefly the motion lab, and this is so valuable in terms of preventing injury long before you can get to that point. When you're out there and you're swinging the golf club or playing any sports in general, you can't see what you might be doing. You might be overcompensating in some areas, and the motion lab really takes a look at every part of your body with a golf swing analysis, since we're talking about golf, where you have leads all over your body, and you can actually go back with the therapist and they can show you what you might be doing wrong to avoid injury.
It's really been the biggest asset I've found in the recent years. As I mentioned, there's limitations to even what the best orthopedic examiner can do in an exam room. We can't capture some of these dynamic things that people are doing, and I see plenty of patients that have some kind of pain, and their exam seems benign, their X-rays seem benign, maybe an MRI was ordered, and that doesn't really show much, but they have pain and they're not getting better. And then we go and we put them through one of these motion analyses, and we find that it's without knowing it, it's become a chronic overuse type injury, just the way that this individual is moving. And so this is really a step much above simple just video analysis of a swing, but actually putting those leads, marking the bony landmarks, creating a 3D avatar, if you will, of the individual performing that motion, and then having people, doctorates in kinesthesiology and motion analysis that can really point out how that motion can overstress another joint, and how if we can correct that, either postural or dynamic component, we can alleviate pain without anything further besides that.
It really is quite remarkable, and I think it just gives the patient that different perspective of seeing their body from the outside, if you will, because when you're doing sports, it's hard for you to see what you might be doing incorrectly and overcompensating in certain areas. The Bone and Joint Institute, there's also the Center for Musculoskeletal Health, where the motion lab is in, but there's also other equipment, almost like an Olympic style training facility, if you will, right here in Hartford, Connecticut. There's the anti-gravity machine. There's other types of machines that you have there to also help patients prevent injury and also recover from injury. Let's talk a little bit about that.
Yeah, I've really, I like to say I've made use of probably every corner of that facility so far. I've had patients even that might be rehabbing somewhere that are struggling, and then I say, why don't we try over there? And just the analyses I've found have been some of the most thorough I've ever seen. The feedback I've gotten from patients has been universally positive. But you're right, you mentioned the anti-gravity treadmill, which people may not know entirely what that is, but it's a way for anyone who's got problems with a weight-bearing joint, anywhere from the low back, the hip, knee, ankle, if they're recovering from injury or surgery. It's an opportunity to get weight bearing on a treadmill, but there's a harness that allows to take some of the weight off the body, almost analogous to being doing aqua therapy or being in a pool. But we can adjust that so patients can gradually get back into weight bearing, so they can use their muscles without having the full force across that joint at the time. So I've definitely made use of that for a lot of my post-surgical patients. And then the analyses for especially return to sport testing, I keep coming back to the limitations, and I see re-injuries and some of the things we treat, and I really believe it's just under rehabilitation for a lot of those. And having the one thing you didn't mention yet is the strength and conditioning team. Really just the people that really get you to that final level that you've completed your therapy, but now you're ready for really just the closest to live play activity you can get is with them, and it's really been rewarding. And the follow-ups I've gotten, the 12 or 14 page reports. I have to, I'll remain humble here and say some of the analyses are above my level of understanding, but the summary pages are always very precise, and patients come out of there with a very good understanding of areas for improvement.
Well, yeah, and it just further puts the exclamation point on rehabilitation and that process and why that is so critical. And research does even show that you need to follow it all the way through, and especially if you do want to return to play, that you're conditioned and you're ready to go. And if you want to get back into sports play after an injury.
Right. The great majority of orthopedic problems are not surgical problems.
Mm-hmm.
They are things that have occurred because of limited joint mobility or perhaps being deconditioned or not having quite the core or other balance that we need. And, I can sit back and let a lot of the treatment happen through the rehab centers just by making a diagnosis and leaving them in the hands of the folks at the Center for Musculoskeletal Health.
Right, and a lot of times, and as you mentioned, surgery, of course, always is the last resort. You do treat first with conservative methods to approach whatever the injury might be or whatever the case might be on an individual patient basis. But it is important, I think, that critical conditioning as well as the rehabilitation part of it to keep athletes strong and healthy and to keep them active and doing what they love to do. Would you agree with that?
I agree wholeheartedly. I wish we don't always have the luxury to do this, but it would be really nice. We do this obviously for our adolescents in pre-participation evaluations. But I think anyone getting into sport, even if they're new to the sport or if they've just taken the winter off, or in this case, winter plus a few months off, to just go and have a basic assessment. I mean, I think what I say to anyone who sort of snubs the idea of therapy, they think they're in great shape. My feeling is we can all be better, physical versions of ourselves, and even we also, as you know, we have sports psychology as well.
Mm-hmm.
There's lots of things that we can do better, no matter how good we are, and I wouldn't mind if all my patients took advantage of an assessment just to see where they stand and maybe learn something about themselves. Some may not need much tweaking whatsoever, and some may realize that they've got a moderate risk factor that we can help avoid the injury.
Yeah, absolutely. The risk assessment, I think, is so vital to at least help you know where you stand, and again, to avoid injury. And it's really a multidisciplinary approach that you have at the Bone and Joint Institute, from the Center for Musculoskeletal Health to the Motion Lab to the rehabilitation to the surgeons like yourself. It really is a very multifaceted program that you have.
Yeah, it's one of the better parts of the job for sure. We can get caught working in our own little silos, but I look forward to getting together with the team and just communicating about the overall progress, because without one piece we can't do the job completely, and it's really been nice with working with this team.
Absolutely, you're all connected, and you do such a wonderful job with the Travelers kicking off today, round one of the tournament. What's your advice to players who are getting that fever they can't go and watch, but might be at home watching and then wanting to hit the golf course themselves? What's your final piece of advice for them to avoid potential injury?
Well, the one thing that seems most relevant this week is hydrating ahead of time.
Mm-hmm.
You can't emphasize the impact of dehydration on sports performance. So hydrating before going out and having that water bottle with you during the event. But I think it's like anything. I think it requires an appropriate warm up. It's very easy to walk out and just say, okay, I can go and do this. But if it's golf, you go out, pick your routine, go out to the range, and maybe start, take a few shots with your wedges, work through your irons, your driver, go take a few putts, and then go out and do it, and do the appropriate stretches that you may have learned or you could learn from one of our rehab specialists. As it pertains to walking the course, same kind of thing. If you have any limited mobility due to a known history of arthritis, consider riding on the cart so there's less stress on the knee, or come in and get evaluated so we can help come up with some ideas that help someone tolerate that problem a little bit better.
Well said. Well, Dr. Cliff Rios, thank you so much for sharing a little bit of your time with us today. We appreciate it. And I'm sure all the golfers and athletes out there appreciate the tips as well. So thank you for joining us.
Pleasure.
Take care. Well, for more information, you can log on to hartfordhealthcare.org/Bone and Joint Institute. I'm Hartford Healthcare's Tina Verona. Thank you so much for watching, and we'll see you soon. Stay safe.